Now, joining us to discuss more on this from our Kano studios is Professor Isa Sadiq Abubakar, Director, Center for Infectious Diseases Research at Bayero University. Thanks, Prof, for joining us, and good to see you again.
Thank you for having me.
Now, studies show that the NTDs are mostly due to lack of clean water and unsafe ways of disposing human waste. Does this suggest that it is more of a development problem than a health issue?
Well, it is both. I consider it as both a development issue as well as a health issue, simply because of the points you made, that they are associated with poor environment where water is a problem, and then there is scarcity of safe disposal of feces facilities, as well as poverty and the neglect of people. So the resultant effect of most of them is a morbidity rate that is increased. People are diseased, many die, and then many are left with disabilities that are long-lasting. And all these are not good for socio-economic development, because when you have a diseased society, then you are left with a population that cannot contribute to the economy. And so it is both a disease that affects the population adversely and will not help in socio-economic development.
Prof, just going by the name neglected tropical diseases is even troubling. What needs to be done to give it the required attention?
Yes, actually it is a disease of neglected populations, people that are not able to contribute towards the economy. There is need for the world at large to have all hands on deck so as to do away with the neglect of those diseases, because there are diseases affecting mostly the most impoverished people in the population who are socially excluded. We need to have governments, communities, leaders, development partners all coming together to ensure that we reverse the trend of the neglect. We must do all that is possible within our powers to ensure that we provide the needed resources so that a lot of water will be available for people, so that they will avoid contaminated water, and then some of these diseases that have to do with scarcity of water will be eliminated. Some as those that rely on safe disposal of feces, and that is why the WASH strategy, which deals with water, sanitation and hygiene, need to be given a priority by government and by the communities at large. Development partners need to also do much more than they need to do, more than they are doing in funding some of these control programs, and then we will have a cause to rejoice if we begin to reverse the trend of rising cases of neglected tropical diseases, especially in our poorest of the poor communities.
Prof, I know that a lot has to be done at the government level and at individual levels, but we need to also zoom into personal responsibility by citizens and communities at large, because we understand that one of the major contributors of NTDs is open defecation. What action plan do you think community level, family levels, as well as the government can take?
Of course, I totally agree with you that we must take personal responsibility for ensuring that we remain healthy as individuals and families within all our communities. And to do this, we must do everything that is possible to ensure that we are disease-free, not to even allow the diseases to occur. And of significance to this is to ensure that we have made possible arrangement to to save water, not to waste it, and then water will be available, and then to ensure open defecation is eradicated from our own ways of doing things, and we ensure that hygiene generally is given a priority in our own lives as individuals and families within our communities.
Looking at the staggering number, over 1 billion in the world and over 50 million in Nigeria at risk, with about 100 million being infected yearly, don't you think there needs to be a greater sense of urgency at government at all levels, both the subnational and the federal? And what are the action plans? I know you answered it in a bit, but I needed a bit more specifics.
Yeah, actually, we need to do more at the federal level as well as state and local government levels in ensuring that we give a priority to the neglected tropical diseases generally. Apart from just having it in our National Strategic Health Development Plan, which is already an achieved target, governments need to increase political commitment and to ensure that financial resources are made available, and then to ensure that even health workers who are in charge of preventing as well as curing these diseases have better training, they have better materials, we have drugs available to tackle some of these diseases. As of now, only targeted chemotherapy is being done to against some of the diseases like onchocerciasis and some helminthic diseases. We need to do more. We need to do a lot of mapping. We need to create greater awareness among the populace, and then to ensure that people take their own responsibilities also, so that we will all put heads together and fight these diseases out of our communities.
Thank you, Professor. Thank you so much, Professor.
Thank you very much.
Isa Sadiq Abubakar is the Director, Center for Infectious Diseases Research at the Bayero University in Kano. Thank you so much, Prof, for your time.
You're welcome. Thank you very much.